Germ zapping robots are killing viruses and bacteria at Newton-Wellesley Hospital. These new robots were unveiled last week with their staff-picked names and a demonstration on how they protect patients from getting sicker while they're there. Meet Germinator and R2Clean2, the germ zapping robots now in residency at Newton-Wellesley Hospital. In 5 minutes, one of these robots will deliver a no-touch room disinfection, reducing the number of patients who may get a hospital-acquired infection like MRSA, Ebola, C. diff, norovirus, the flu, colds, and so on.
That having the robots will allow us at the end of a hospital stay for a patient to really do everything we can to make sure that we've destroyed all those lingering bacteria or viruses that might stay behind, so that the next patient who's coming into the room won't be exposed to those organisms on their stay in the hospital.
Using an ultraviolet light such as UVC, which is filtered out by the Earth's atmosphere, will kill or inactivate viruses and bacteria. It's not just for patients' rooms, but every room in the hospital, from bathrooms to operating rooms.
At the end of the day, to try to make sure that the operating rooms are as clean as they can be, adding to the routine cleaning that they do at the end of the day, an end of the day clean to really try to use the robots and the ultraviolet light to make sure that we've killed all the organisms that might be staying behind after complicated surgeries.
The way it works, an environmental service staff member wheels in the robot after a manual cleaning, programs the timer, and sets up the appropriate safety signs. Newton-Wellesley already has a low rate of patient exposure to hospital-acquired infections, but with the Xenex robots in place, that rate could go down or be non-existent.
Research that's been done using these robots has shown that in other hospitals, other healthcare systems, that rates of hospital-acquired infections have gone down over time, that it's a big win for hospital safety and for cost-effective care to prevent these kind of complications.
Each robot costs approximately $125,000, but compared to paying for recovery from infectious diseases or deaths, saving just a few people will cover the costs. But it's not all about the money.
Just saving a handful of bad infections will pay for itself over time, that the use of more broad spectrum antibiotics hopefully will decrease over time as well. Saving a few courses of therapy can pay for the robots over time, and really we're trying to do what we think is the right thing to do to try to protect our patients too. So sometimes spending a little extra money up front to really think that you're doing the best possible job you can is important for cost savings later, and also to just feel like you're doing the best for your patients.
Newton-Wellesley has 2 robots, and depending upon their usage, there may be more Germinators and R2Clean2s acquired.
If we see that the results are good, and if we can really justify a good payoff, then if we find that there's increased need, then maybe future investment would be worthwhile. But I think we'll take the good results we have so far and move forward and see how it works over time.
Xenex has been producing these robots for over 5 years. They're in hospitals, homes, schools, and all over the world. Jen Adams, Newton News.